Here's the ampulla. Here is the seminal vesicle right up over here. Vas deferens, seminal vesicle. If we kind of follow them, they're going to form a duct. This is going to be the beginning of the ejaculatory duct, which is running this way, so we can see the ejaculatory duct right below my stick right there. The ejaculatory duct is going through this gland over here. This is the next gland after the seminal vesicle. This is called the prostate gland. Okay, the prostate gland. And you can see the prostate gland, I meant to mention this before, is right next to the rectum. So when the male goes for a prostate exam, the physician or the examiner actually puts the finger into the rectum and is able to palpate the back of the prostate. It should be soft and boggy. That should be a normal prostate. If it was hard and nodular, that could be a sign of cancer or something like that. So here's your prostate gland right over here. Ejaculatory duct. All right, so again, this is where the semen is made. Let's look at the bladder for a second. We looked at this last week. This is all the urinary bladder. This is the smooth muscle of the bladder. I forgot if I mentioned it here. This is called the detrusor muscle. I forgot if we have to know that. You may not have to know that here. This is the rugae that makes up the mucosa. This is the internal urethral sphincter right here. This is going to be the prostatic urethra. All through here, this is prostatic urethra. Where the pelvic floor is right here, this is going to be the membranous urethra right there. It's just that little piece. And then the rest here, guys, going through the penis is going to be either the penile, or I heard somebody say the spongy urethra right over here. There is a gland, it's not shown on this model, but right about where the pelvic floor is right here, there's a little gland called the bulbourethral gland, and there would be a duct going right to the spongy urethra right about there. That's the one that puts that secretion, that's the alkaline, kind of a slippery, thicker secretion that's going to help lubricate this spongy urethra, but also neutralize the acid of the urethra, and to lubricate the gland's penis, that type of thing.